Timothy, Ashley, Melanie, and Valerie. Hi guys, my name is Brittni Howard, and today I'm going to be persuading you on why it is a good reason to purchase health insurance. Nearly 1/3 of the Americans face each day without the security of knowing that if and when they need it, medical care is available to them and their families. The patients that are unable to pay for their medical bills receive a large fee, but the bills usually get paid by the hospital themselves, or it could be your neighbor that's paying your bills. Some of us are about to get to that age where we no longer are covered by our parents' insurance. And let's be honest, none of us want to pay that big fee every month. But today I'm going to show you the important reasons why it would be worth to spend the extra about $250 a month. I'm going to talk to you about what happens if you are uninsured, the pros and cons of actually having insurance, and what the difference is between Medicare and Medicaid. I know most of you, like me, would much rather pay their money on materials such as clothes, shoes, cars, all that fun stuff. But have you ever considered putting that fun money away for something more important that can help you in the long run? If you're using that money to go out to eat or concerts, it's not going to help you 5 years down the line. Now what happens if you're an uninsured patient in a hospital? Stated from The Pros and Cons of Health Insurance by Rod Howell from ehow.com, at any moment, a sickness or an accident causing injury can create a huge financial burden if the costs escalate. The saying that this could cost you an arm and a leg could literally cost you your arm and leg without health insurance. What happens if you break your leg without having health insurance? It'll take you out of work for a long time if you are working in a place where it asks for being very active. How are you going to pay your bills? And finally, how are you going to pay your health bills from being in the hospital and getting that cast? That's, in just 1 week, that's thousands of dollars that you will not be able to pay. According to PBS.org, 44 million Americans are insured, and 8 out of 10 of these are workers and dependents. That stack of bills is causing people not to go to their yearly checkups, and it's causing more problems for their futures because they are missing out on the chance to find something that could have been preventable. Stated by PBS, just like I was saying, stated by PBS.org, there are more likely to be hospitalized for health conditions that could have been avoided years before. Gallup also recorded that the uninsured rate has decreased since 2013 due to the Affordable Care Act. A lot of people are against it, but it is, for sure, helping our hospitals. From the perspective of a case manager that works at Nebraska Medicine, he's worked there for about 17 years, he has ensured that there are fewer self-paying patients today than there were 2 years ago. It also gives people the peace of mind that knowing that they have access to medical attention and are able to live without worrying. Stated from The Pros and Cons of Health Insurance off of ehow.com. Some plans can help you by customizing your own rates, so they choose what is affordable to you and will help you with your deductible for the future. And there are some cons, like the premiums could be very high, and that is mostly the reason why people choose to be uninsured rather than to purchase insurance. Stated from ehow.com, the less expensive insurance plans have limitations on office visits, high deductible amounts, and predetermined doctor network. So it's saying you might have an affordable health insurance plan, but it really isn't going to cover very much for you. The pros and cons of health insurance kind of balance each other out. The only difference is what you can and cannot afford. And then that brings us to Medicaid and Medicare. According to MedicareMadeClear.com, Medicare and Medicaid are not the same thing. The only thing they have in common is that the money comes from the government. Medicare, stated from MedicareMadeClear.org, is available to patients that are at least 65 years or older. It's from the federal government. You choose the coverage you want. You get 3 choices. And the cost depends on the plan you choose. And then Medicaid, the difference is that is a program for families who are on a lower income, but it is different from state to state. So you could be covered for certain things in Montana, but covered in something completely different in Nebraska. And so what we have learned throughout this speech is that it's more expensive to be uninsured than paying the monthly fee for insurance. We've learned the pros and cons of having health insurance and the difference between Medicare and Medicaid. It is important to have health insurance because you'll be able to sleep at night knowing that you are saving yourself from a ridiculous amount of debt. It is important to know that you and your family's health could be all that you have at the end of the day. Wouldn't you want to be sure that all the health care costs are covered?